This might look like a typical doctor's office visit, but it's not. Evan Riley has insurance, but he didn't want to miss work by having to wait for his primary care doctor to fit him in, and his mom didn't want to take him to a walk-in clinic.
The last time I went to one, I paid $45 for the copay, and like 3 weeks later, I got a bill for $400.
So they came to iHealth in East Liberty to see Dr. Timothy Wong. He opened iHealth 7 months ago and is working 6 days a week now to make it work.
I've worked in kind of the traditional setting for almost 5 years after residency, and I kind of lost faith in the system. You know, we had so much inefficiencies, we were letting down patients, and it was actually worse than I even realized because I never even saw really how many people didn't have insurance.
He says about 8.5% of people in Pittsburgh don't have insurance coverage. That's 25,000 people. He wanted to make it affordable for them to see a doctor. So Dr. Wong doesn't deal with insurance. The bill is always $35. By not having to deal with insurance paperwork or a billing department, he massively cuts down on his overhead costs.
I pretty much do everything. I do kind of the IT, I do check-in, we get billing done right at the appointment, so we don't need a billing department.
He estimates if he sees 20 patients a day, he can earn about 65% of an average doctor's salary, and he describes this as much more rewarding.
It is out of whack. It's so inefficient in that not only do people with insurance have to pay more than if they just paid cash a lot of the times. For example, I had a patient with insurance. She paid $230 for blood work with insurance. And when she came to me, when she didn't have insurance, we got her a special deal and she only paid $30.
But patients are coming in who do have insurance, like Evan.
He could take me at any time, like it's a walk-in. I don't need to make an appointment 3 days ahead to be able to walk in.
And you can still go back to work today if you need to.
Yep, which I plan on doing.
For this diagnosis, Dr. Wong thinks it's just allergies, and with a prescription, Evan can get back to work today. And Dr. Wong can wait for the next patient to walk in and try out this new medical model. Michelle Wright, Pittsburgh's Action News 4.
Very interesting. And Dr. Wong did his residency at UPMC Shadyside Hospital. He says if additional testing such as blood work has to be sent off, there could be an additional fee. iHealth is open every day except Sunday.